Okay, welcome to Wisconsin Facet's webinar on specific learning disabilities. On behalf of the entire Wisconsin Facet staff, I'd like to thank you for joining us. My name is Lori Karcher, and I am one of the help desk specialists here at Wisconsin Facet. The title of our workshop today is SLD, and a description. Up to 1/3 of parents with children with LD don't feel prepared to take on the challenge. This webinar will help you learn more about the truths about specific learning disabilities and the Wisconsin SLD Eligibility Criteria. What is SLD? How is a child found eligible? And what resources are available? Our presenter today is Elizabeth Cook. She is the school psychology consultant for the Department of Public Instruction. She is licensed both as a school psychologist and a private practice school psychologist and has experiences in rural, urban, and suburban settings across 2 states. Parent advocacy has always been a central focus of her work, and she is excited to present to us today for Wisconsin Facet. So I am going to now let Elizabeth take over and enjoy the presentation.
All right, thank you. Can you hear me okay?
I can.
Perfect.
I'm going to mute myself now.
Sounds good. Well, welcome everybody. Good afternoon. Thanks for spending your afternoon lunch hour here with me. We are going to talk about comprehensive evaluation for students with specific learning disability. The topic tends to be a little content heavy. It gets a little jargony and wonky at times, so I will try my best to bring as much clarity as I can, but please, if you have questions or you just want clarification on things, or if there's a term there that you need to find differently or better, please don't hesitate to put that in the chat box and let me know. The whole point of this presentation is so that you all leave with a better understanding of identification of students with specific learning disability within the context of a special ed eval. And so if you leave here without that, then I have not done my job effectively. So with that being said, what we're going to do today is first remind everybody that October is Learning Disabilities Awareness Month, so it is highly appropriate and fortunate that we are meeting here today to talk about SLD. So you can go check out ldamerica.org and see some of the resources that they have for advocacy, stigma reduction, and those kinds of pieces there. So what we're going to do today in the hour that we have together is that we're going to first set the stage with some basics. I really want to root us and orient us into what it is to do a comprehensive evaluation, of which determining whether a student has a specific learning disability falls underneath that. Then we'll kind of get into the nuts and bolts of the SLD rule. And then we're going to talk a little bit about dyslexia. There's a lot of myths around dyslexia. There's a lot of confusion around dyslexia, both within the school setting and also within the community setting. And in my experience as both a practicing school psychologist and also providing consultation to the field here at the department, I know that there is a lot of concern out there from community, parents, and school staff about what is it that we do as it relates to dyslexia. So we're just going to talk about it because that's the best way, I think, to get a common understanding and find our best way to move forward. And then there should be an opportunity for questions. So before we get started around the specifics of SLD, I want us to have some common language as it relates to comprehensive evaluation and evaluation for special education broadly. So first, let's talk about who is a student with a disability, and this is true for all disabilities. This isn't specific to SLD. But per IDEA, in order for you to have a disability within the school setting, the IEP team first has to identify a child as having a disability, an impairment that adversely affects the student's educational performance. And as it relates to schools, there are a limited number of impairment areas, both in federal and state law. Specific learning disability is one area of impairment, but there are others, right? You know, autism, other health impairment, intellectual disability, et cetera, et cetera. So SLD is one area of impairment, the one that we're specifically going to focus on today. There's a second prong to special education eligibility. That's important to know, and this is what differentiates school identification with community or clinical identification oftentimes. In addition to having one of the impairment areas listed within the law, a person must also, as a result of that impairment, have their educational performance adversely affected to the extent that they need special education or specially designed instruction as a result. So it's not enough to just have endorsed the impairment to say, yes, this meets the criteria for a specific learning disability. The team is also determining, because of that learning disability, education is really adversely impacted to the point where it requires specially designed instruction. And we're going to talk a little bit and unpack that a little bit as we move forward. But keeping those two prongs in mind are going to be really important, especially when we get to the dyslexia conversation. So what is an evaluation? How do you determine if someone has an impairment as identified in state and federal law, and whether that impairment adversely affects educational performance, such to warrant specialized instruction? And so we do that through an evaluation, and this definition comes straight from IDEA. So evaluation means procedures used to determine whether a child has a disability and the nature and extent of the special education and related services that that child needs. So again, you can see that two-prong aspect of eligibility reflected in the definition of an evaluation. When you're doing an evaluation on a student, right, regardless of what the concerns are, the focal point of that evaluation should be both determination of eligibility, right, whether or not you meet that criteria for an impairment, and the nature and extent of the services that would need to be had as a result of that impairment. The other thing that IDEA requires of all of us is that the evaluation is sufficiently comprehensive to identify all of the child's special education and related services needs. And that's whether or not those needs are commonly linked to the disability category in which someone's been questioned. So let me unpack that a little bit, because I feel like that can feel very big. What IDEA calls us to do and is telling us to do is that when we do a special education evaluation, we're charged with evaluating the whole child, right? And so in a little bit, in several slides, you'll see a phrase on there that says there's no such thing as an SLD evaluation. There's an evaluation for special education services, of which specific learning disability is one of those areas of impairment. But when we're talking about evaluating a person, right, evaluating a youth, our charge and our job is to look at all the data that we have, right, the data that's missing, right, figure out how that student is interacting with their school environment, and what assessment practices or procedures we need to answer the open questions that we have about that student. And so from there, then, we take that information and we decide whether or not they fit one of the impairment categories and then what kind of needs that they have. But the evaluation itself for special education should always be comprehensive. Now, that doesn't mean that every student needs, 15 assessments, right? What that means is that we're always taking a comprehensive whole child approach and thinking about how students interact with every aspect of their environment, not just in the case of SLD, how they may be interacting with reading or math. So generally speaking, as a reminder, here are the basic procedures that are part of an evaluation. First, there's a referral or reevaluation. That's how the process starts. And then there's a notice to the parent to let them know, yes, there's been a referral, or hey, your child's up for reevaluation. As a reminder, anyone can make a referral. Parent requests for referrals need to be honored, and school staff must make referrals if they suspect a student has a disability. That's pretty clear in the law. From there, the team gets together and they review the existing data that they have. So you sit down and you say, okay, what do we know about the student based on how that student has interacted in the school system, prior to this referral happening? What are the grades like? What are the progress looks like in those academic areas? How are they doing social emotionally? And what questions do we have, right? So you sit down, you figure out what questions you have, you review that existing evaluation data, and you determine which of that data answers the questions that you have already. And whichever ones are still lingering, that's where you need to collect additional information. So from there, then, you talk about what additional assessments you may need. You get parent consent for that. And then once that parent consent comes back, you conduct those evaluations. It's important for everyone to know, regardless of eligibility, that a school cannot conduct assessments until they receive your written consent back. That's an important part of the law. After the evaluation has been conducted, you sit down as your team and you talk about the results of that evaluation, and you determine whether or not a student is eligible in one of those impairment areas. And if they are, then you develop an IEP and then you determine the placement. I won't go over this too much in depth, but as a reminder for you, here is in broad strokes the evaluation timeline. It's also available on our website as a visual that you can print out. And so if it's something that's important for you to remember for your own child or for your own for your own job, for those of us who are school-based practitioners, you have this available to you. Something to note is that generally speaking, the timeline has to be followed. There is an exception in the state of Wisconsin to extend the timeline of an initial evaluation if one of the areas in question is a learning disability. And this is to allow time for interventions, and we're going to talk about what that could look like kind of in a few slides here. A timeline extension must be mutually agreed upon. So a school can't just arbitrarily decide that they want an extension without parental involvement. And that extension extends the entire evaluation, not just the components that relate to SLD. Why that's important is because, remember, it's a comprehensive evaluation. And so if you also have concerns, let's say, around speech or OT or emotional behavioral skills, for example, in order for that comprehensive evaluation to be completed, all of that stuff needs to come to the table at the same time as much as possible. So that extension extends the entire evaluation, not just the components that relate to the learning disability question that needs to be answered. I want to really quick pause and do a little bit of splitting. I feel like we often use the phrase evaluation and assessment interchangeably, and I think that that can be confusing. It's confusing for the field. I think it's confusing for parents. So when we talk about at the department an evaluation, the evaluation is the big set of procedures or processes that you use to determine whether or not a child has a disability and the nature and extent of that disability. The assessments are the tools, right? The formal and informal things that happen to inform that evaluation decision. So if you can think about it, the evaluation is the big umbrella, the assessment is the tools that fall underneath. So if that sounds good to everybody, we will get into the nuts and bolts of how this relates to SLD. I put the definition of SLD on the slide here. I won't read it to you. What I want you to be aware of is that the SLD definition in PI 11, which is the state rule that governs all things related to special education eligibility, is that the definition actually has what SLD is and what SLD is not. And having both of those things impact eligibility in really specific ways. So what we know is that a specific learning disability involves understanding or using spoken or written language that manifests itself in difficulties with listening, thinking, speaking, writing, or spelling, math, et cetera, including, right, perceptual disabilities, dyslexia, developmental aphasia, et cetera. So that's what it is. We also know that a specific learning disability is not, right, a learning problem that are primarily the result of other kinds of factors, right? So if I'm a person who comes to the world and maybe I have an intellectual disability, we may expect some learning challenges to come with a person that has an intellectual disability. That doesn't mean I have both an intellectual disability and a learning disability, right? That if there's another disability there that would explain why I'm struggling academically, right, that we can go ahead and look at that. That doesn't mean, and we're going to talk about this when we get to exclusionary factors, that a person can't be both, come to the world as a person with ADHD and come to the world as a person with a learning disability, and that those two things interact and are often pretty comorbid, actually. So it doesn't preclude someone from having more than one disability. It just means that the learning challenges that they're having are not primarily the result of other things that are happening. So for the purposes of education, SLD is categorized in sort of 8 main areas. In the world of reading, reading comes in 3 flavors: basic reading, so that's a person's phonological awareness, their ability to manipulate letter sounds, or understanding those basic building blocks of reading. There's reading fluency, which is someone's ability to read both quickly and accurately. And then there's reading comprehension. So that's once I've read the words on the page, do I understand exactly what it is that I've read? And a person can have a learning disability in any of those areas, or oftentimes they interact with each other. Fluency difficulties tend to bleed into comprehension. Basic reading issues tend to impact comprehension as well. In math, we talk about math in 2 different flavors. One is math calculation. That is good old-fashioned, can you do basic arithmetic? So can I add and subtract and multiply and divide? Can I calculate? The other aspect of math that we look at is something called math problem solving. That's the when given a problem to solve or a story problem, something that's a little bit more concrete or abstract that requires a little bit more logical deduction as it relates to math. Can I solve that problem? And so those are two very specific things. We have some students that are more than capable of doing calculation, but once you start throwing it into a more abstract problem, then that becomes difficult. And we have some kids that really can pick up on the language of story problems, but then the calculation part is a challenge for them. And then there's three other areas: written expression, which is my ability to express myself in writing; oral expression, my ability to express myself using my words; and then my ability to listen and understand directions. And I put in here the graph. I thought you might be interested. This pie chart, it is not very pretty, but it is the students with disabilities by eligibility in the state of Wisconsin based on last year's data. And about 22% of our students that are identified as having an IEP or needing an IEP have a specific learning disability. It's tied with speech and language impairment in terms of the highest proportion of students who are identified. So when we talk about evaluation and assessment for SLD, this is what it means, right? So what's the evaluation procedure for SLD? There's three main components to it. There's the interventions aspect of it, there's the assessment aspect of it, and then there's consideration of exclusionary factors. Within each of these components, there are some things that are explicitly spelled out by law that schools cannot deviate from. When it comes to interventions, there needs to be two. In the area of concern, it needs to be progress monitored a particular way. We're going to talk about that next. When it comes to assessment, schools must do observations, they must do progress monitoring, they must do an achievement test, and then they also need to do other relevant assessments that help to bridge the knowledge gaps around what that comprehensive evaluation may need to also discover. And then IEP teams are required to consider exclusionary factors. So remember, we talked about that SLD is what it is, but also what it's not. So the consideration of exclusionary factors is assurance statements around, we're saying that what we notice about this student is not because of these things. So put differently, what we call that in the sort of the rule language is insufficient progress, inadequate classroom achievement. So what you do is you take insufficient progress, you add it to inadequate classroom achievement. Once you get all that data, you put it through the lens of the exclusionary factors, right? Kind of like a flow through, like a car wash, I guess. I don't know if that's a good analogy or not. I just made that up right now. And then you determine whether or not the child meets the eligibility criteria for the impairment. And then second to that, whether or not, if they do, there's a need for special education services or specially designed instruction. So we're going to break this down a little bit in the time that we have, because that is why you're here today. So insufficient progress is defined in PI 11 as a student not making progress as a response to intensive scientific research-based or evidence-based interventions. The SLD rule requires two interventions to be conducted before a team determines progress has been insufficient. So SRBIs is the shorthand acronym that we use for scientifically research-based intervention. So you'll see and hear SRBI a lot throughout this presentation. The important thing to know about this is that in order for an IEP team to determine that progress hasn't been sufficient, that a student has to be through at least two of these intensive interventions. So what's an intervention? You may be wondering or asking. Broadly speaking, an intervention is something that is done, a technique or a practice or a program with a small group of students or an individual student that's really targeted to improve the learning. And interventions are things that happen all the time in schools as part of what we call a multi-level system of support. So even outside SLD, eligibility questions or concerns, students who are struggling academically are moving in and out of intervention systems within the school system. So, you know, I have a son, so they may decide that my son is struggling with reading, and so they'll put him in a small group where the teacher or reading specialist is really specifically focusing on some of the things that he's reading about or having challenges with, and then if he's making progress, great. Then he moves out of that intervention, and if the progress isn't going like they would hope it would, right, if his reading's not improving or not improving well enough, then they may change or intensify that intervention. So interventions happen on multiple different levels, but for the purposes of specific learning disability, we're really specific to make sure that it's the most intensive services that students are receiving. So it has to be scientifically research-based or evidence-based. It can be used with an individual or a small group, and it needs to focus on a single or small number of discrete skills closely aligned to the individual learning. And so if I have a student who's struggling in letter sound identification, for example, then they would get an SRBI as it relates to that, and not necessarily as it relates to comprehension or writing or literacy as a broad base. We make a point to try to ensure that they're culturally responsive, they're implemented with fidelity in the way that it's meant to be implemented, and that interventions, if you get kind of a package intervention, usually come with a prescribed number of week sessions or minutes, and the rule requires that a student be in that intervention at least 80% of those week sessions or minutes, because if it's less than that, it's hard to determine whether or not they're making adequate progress. So we've got some rules around who can provide interventions. I'm not going to go into details here, but if you're interested to know who is able to provide them and under what conditions, we have a frequently asked question number 30 that helps to address that. And then we've got a white paper on licensure requirements for providing students with interventions. Generally speaking, it's someone that's highly qualified in the area of concern, right? The idea is that if our folks are struggling the most, that we want our most prepared, most capable staff working with them. So how do you determine if the progress is sufficient, right? So they're in this intervention, and how do I know? How do I know if the progress they're making is good enough? There's a process for this too. The first thing that you do before a student starts their intervention is you establish what's called a baseline. And the rule is pretty specific about how this happens. You take something called a progress monitoring probe. We're going to dig into that in a couple of slides. And for each intervention, a baseline of 3 of those probes needs to be taken. You do 3 of those probes, and then you take the middle score. So whichever one kind of falls in the middle of those 3. The idea is that you don't want to do it once because maybe a student's having a bad day, and we never want to hold a student accountable for having a bad day. So that's why we do 3, just to be sure that what we're getting is a good, true number. Then you begin your intervention, and during that intervention, at least once a week, you need to collect that progress monitoring data using that probe that you used for your baseline. The important thing to know here is that that information that you're collecting needs to be at grade level, not instructional level, because the whole point of intervention is to help students catch up to their same age peers that aren't struggling. And so if we're only ever measuring them on what their abilities are, then it's, at their actual instructional level, then it can be difficult to determine how close or far that gap is between what they know and what the students that are in their classrooms know. And then once you do that, you use that information to analyze the progress, right? And you use this whole statistical thing, which is not really relevant to what you all would be doing or worried about, but I will show you an example of what that looks like. And so then you compare them to the same age or grade peers and say, how does this look? Does it look like they're catching up or not? And so the important thing to know here is that an intervention can be implemented before a referral or as part of an evaluation for SLD. The timeline doesn't matter as much so long as they're happening in a consecutive way and they're hitting the things that they need to hit. So I talked about probes a lot in that last slide, so it'll be important for me, I think, to really talk about what that is. I feel like if you're not in the world of SLD, you're like, what is a probe? And the thing that comes to mind is probably not a progress monitoring assessment tool, unless you're a school psychologist or a special ed teacher or reading specialist. So progress monitoring is this idea, right, that I am taking small stepwise data points to see whether or not the thing that I'm doing with the student is actually doing the thing I want it to do. And schools do this all the time in a variety of ways. It doesn't just relate to academics. We do this with kids' behavior as well, where we say, like, okay, we have an outcome that we want you to do X. We want you to be a better reader. We want you to listen in class differently. We want you to pay better attention, or whatever it is that we're doing. And we put in an intervention, whether it's a big intervention like we're talking about with SLD, or a small intervention like I moved you to the front of the class. And then the classroom teacher, right, takes information on whether or not that is working, right, towards the outcome or goal. It's the same with SLD. The difference is, again, because this is a high-stakes decision, everything gets ratcheted up. And so progress monitoring for SLD requires something called a probe. Probes, by definition, have to be brief. They have to be direct. They have to have forms that are equal or nearly equal. And that becomes really important for schools in terms of their selection. It has to be sensitive to small changes because you're doing it every week. And so if you have something that won't show you any progress for 4 or 5 or 6 months, then you're not going to be able to tell whether or not your intervention is working in fast enough time to actually be responsive to that because we don't have a whole year or 2 years or whatever else to see if students are going to learn to read. And they have to be valid and reliable. Okay, so you did your interventions, you took all this data. So I feel like maybe you're asking, like, Elizabeth, still have not answered the question about how I determine whether or not that's good enough. And so this is the part where we use the information to analyze what it is, right? So for the purposes of SLD, there's 3 ways in which SLD decisions are made. The first is that the rate of progress is the same or less than that of his same age peers. So if the student that is being assessed has a rate of progress that is identical to or less in terms of the rate as the same age peers, then that student would meet the insufficient progress criteria of the SLD rule. You may be wondering, like, well, if it's the same as peers, why would you be eligible? Because when we're talking about rate of progress, and this gets a little tricky because I talk with my hands and so you can't see my arms, but you can imagine like my arm being on a little slope here. When we talk about rate of progress, kids that don't struggle with learning pick up on things in a particular way at a particular pace, right? So I learn to read at a particular pace in a particular way. What we know about kids that struggle is that in order to catch up to your peers in terms of the same rate, right, because there's a gap, you actually have to make more progress than we would want or expect, I should say, from a typically developing student or a student who's not struggling with learning challenges, right? Because in order to close that gap, if you're at the same rate, then those lines go parallel, right? So in order to get that gap to close, the lines can't be parallel. The second way that a person can meet this criteria is if the rate of progress is greater than the same age peers, but is not going to result in reaching the average range of achievement in a reasonable period of time, right? So you may have a student and that student's really rocking and rolling and the rate's really great and everyone's really excited, but you're really projecting it and you're like, man, this is going to take a whole year, 2 years, right, a really long time, right? Then we would talk about that this person maybe meet that insufficient progress criteria. And the third one, and this is one that I think is the most interesting and in my experience, one of the most underutilized in the field, is this idea that the rate of progress is greater than the peer, but the intensity of resources that are needed for that to happen basically warrants specialized instruction, right? The reason that that progress is what it is because of the amount of resources and supports that are being put into it, and that's not sustainable in kind of our normal multi-level system support processes. So those are the 3 ways that you meet the insufficient progress criteria. This is an example of an AIMSweb graph. I just pulled it off the internet for you. But you can see here that black line is the rate of progress that you would be looking at, right, that you would want. The red line here is the student's actual data from that probe. And that little dotted red line is the rate of progress, right? So when you kind of do the statistical analysis on all of those dots, you see a slope that's going slightly up, but certainly not up enough to meet that black line. And what we would really want it to be doing is meet or exceeding that black line. So that's prong 1, right? Prong 2 is inadequate classroom achievement. This one's a little bit more straightforward to explain. So after you've done those intensive interventions, then a student receives an achievement test, and that's a norm-referenced, standardized achievement test in the area of concern. It's individually administered, so someone like a school psychologist or a special education teacher will take your student and give them this assessment in the areas of concern, and they need to get a certain score. It's actually 1 1/4 standard deviation. Usually comes out to like 81.25. It depends on the test that you're using though. And there is some wiggle room here because the scores are kind of funny in that, like, if you get an achievement test, or it's the same for IQ test, you may have a specific score, but that score actually represents a range. And so if all other criteria are met for SLD, you can take the range that score falls into. It has to be administered after the intervention, right? Because the whole idea is that you're trying to test the progress after the interventions are done. And the same cut score applies regardless of the student's other abilities. And you have to do that for each area of concern. So after you've done all that, right, so you've got your progress monitoring data, and let's say the student is not at the same rate as their peers, and then you have achievement scores that are low, then you say, okay, so they meet these criteria. Now we need to put them through the lens of exclusionary factors. And what that really means to put something through the lens of the exclusionary factor, is that the challenges the student is having with their academics, right, with their ability to move forward and make progress in reading and math or writing or those other areas, cannot primarily be due to the things that are listed on this slide. So other impairments, environmental, cultural, economic factors, limited English proficiency, or lack of appropriate instruction. And those are important because, for example, let's take lack of appropriate instruction. If you have a student that wasn't receiving the instruction that they would need to make progress, we don't want to say that that person has a neurologically based disorder, right? A learning disability, which is, something that's neurologically based and you have for the rest of your life that impacts you. What we want to say is, no, you just need to be taught differently, right? And then we can watch you make progress there. So this is a way to ensure that students aren't receiving the label of learning disability unless we're absolutely positive that there's not other factors that are interfering with their ability to learn. And if there are, then that's our charge of the school to figure out, okay, what do we need to do to help support these challenges that you're having, right, or these other things that are happening, so that you can make the progress we want you to make. Now, what I want to draw your attention to is this idea that the rule is very specific, that it can't be primarily due. And this is something that can trip up schools quite a bit. I'll just be quite frank with you, that you'll have many students that have maybe another impairment or may have some cultural and economic factors that people are talking about, or limitedly English proficient, or maybe have just come from like a homeschooling situation or another kind of situation where you're not quite sure what the instruction look like. That can be true for a student, and they can still have a learning disability, right? In fact, when it comes to limited English proficiency, oftentimes we actually find students with limited English proficiency as having an SLD, but we know that students with limited English proficiency do have learning disabilities. It's our ability to find that and talk about that and give culturally responsive interventions that become a little bit of a problem there and a challenge. So what the IEP teams are challenged to do is have really good, robust conversations around, yes, we recognize, let's say, that this student has limited English exposure, or this student has been absent a lot, right? And so maybe it's limited English, or maybe it's lack of appropriate instruction. But do we as an IEP team think that is the reason, right? The primary reason why that person's not achieving? And if the answer to that is yes, right, then that student's not eligible. But if the answer is no, right, yeah, the student's been absent a lot, but, that's really the short stint of time. And if we look at the history, we find that the student was, has been here for the most part and has always been struggling, for example, might be a conversation that an IEP team would have. Then the IEP team may decide that, you know what, it's not just the lack of appropriate instruction that is making this happen. That's a contributing factor, but it's not the primary factor. So exclusionary factors are really meant to be a conversation. They're not meant to be this one and done kind of checklist piece. It's really about having that conversation around the table with all the folks that are there. So as a reminder, right, that the rule requires that the evaluation is sufficiently comprehensive. So although what I just talked with you about is required, right, they have to be there. There's no way of getting around interventions. There's no way of getting around achievement testing. There's no way of getting around exclusionary factors. That's a requirement of the law. You may want to also supplement with other relevant information. Like I said at the beginning, there's no such thing as an SLD evaluation. This is true also for any other eligibility. There's no such thing as an intellectual disabilities evaluation or autism evaluation. There's an evaluation for special education services, right? And that the necessary components of that evaluation are determined with the IEP team as they develop that evaluation plan. So as you're sitting with that team, you can say, I think my child may be eligible for special education services because of challenges that they're having with reading or writing or math. And then the team sits down and says, okay, let's think about all the factors that are coming in to play there. So obviously the interventions are going to be important, the progress monitoring is going to be important, but there may be other factors, right? Maybe the student has a difficulty paying attention, right, or executive functioning difficulties, which can often be hand in hand with learning disabilities. So those are things that the IEP team is going to want to talk about in that review of existing data, so that the evaluation is sufficiently comprehensive so you're able to answer all the questions that need to be answered for the student. As another reminder, A student's impairment area does not dictate the specially designed instruction they will or will not receive. There's no SLD programming, right? The whole point of having the individualized educational plan is that it's individualized to the need, and it's based on the disability-related need. So you may have a student, for example, who all that is needed in terms of the IEP is specially designed instruction and math calculation, and everything else for that student is okay, right? It doesn't interact, that disability doesn't interact with the world in any way except for when that student is tasked to do math. You may have another student, right, whose difficulty in math interact with the educational environment in different ways, right? Maybe I have a difficulty recognizing and interpreting symbols in general, so it bleeds into my reading abilities or bleeds into my ability to focus or pay attention. That's also a disability-related need that the IEP team then needs to talk about. So it's important to really think about how does the student interact with the environment, and what are the individual needs of the student that affects access, engagement, and progress in the general ed environment. So the additional outcomes of a comprehensive evaluation are not just eligibility. The whole point is so that also you can determine IEP development, right? So the special factors maybe that are involved, to link to your 5 steps of your college and career ready IEPs, what your special education or related services might be, functional skills or the effect on behavior on academic skills, and also determine how you're going to monitor progress and measure growth, right? Because if your student's eligible, then we should be writing IEP goals, right, that address the area of concern. And there should be a way to monitor whether or not students are making progress, right, or growing the way that we would want them to. So I'm going to pause there for a second. I just want to check, I know we had talked about questions at the end, but I wanted to see if there was any questions about that before I moved into dyslexia.
Hi, Elizabeth.
Hi.
So I've been watching the chat box. I haven't seen any questions come in, but it's possible that people were holding their questions, so we can give them a minute or two just if you want to type anything in for what you've covered so far.
Yeah, why don't we do that?
I just want to say you are doing an awesome job, because this is a really complicated and difficult topic, and to be able to present this with energy and enthusiasm and understanding from the parent perspective is really important. And
thank you.
Really appreciate your perspective on that.
Thank you. I really paused the webinar for a compliment, so I appreciate that.
So I'm watching to see if there are questions, and unless I'm doing something technologically incorrectly, which is possible on my end, I don't see anything so far. But I will let the audience members know that if they want to type in questions as we go, I will try to keep track of them so that if we pause again, I can bring them to your attention then.
Perfect. Well, I just have a few slides on dyslexia, and then the floor will be open. So I'll go through this, and then we'll go. I just didn't want people's heads to be, I don't know, like if they were swirling around thoughts around SLD specifically before I got into dyslexia. I wanted to let that breathe for a minute.
Right. Well, and so I was taking notes as we were going along too, and just some of the information that I was, because I talk to parents regularly about many different special ed topics, some of the things that I found interesting were, the fact that you pointed out that 3rd criteria about rate of progress is really important. A lot of parents will call me and they'll ask, well, I don't understand how they're going to get the help they need if they're doing these interventions and it shows that they've caught up. I think it's a really important piece, because then they get discouraged thinking that their student isn't going to get the help or isn't going to be found eligible because of the intervention. Which is important to see, like you said, can that be maintained within the regular ed environment without specialized instruction? So I thought that was a really good point.
Good, thank you.
Well, I still don't see any questions, but I'm going to mute myself again and let you move on with dyslexia then.
Okay, so we'll talk about dyslexia. So this is actually one of my favorite topics to talk about, which I always enjoy saying, because I think that there's some nervousness on everybody's part around this, right? From the department's part, from the field's part, I think from parents' part, from the community part. And like I said earlier, my general style or approach is like, let's just talk about it for what it is, and then we can figure out where there may be similarities and where there are differences, but at least then we're all talking the same language. So I pulled this definition of dyslexia from the International Dyslexia Association. It's actually an organization that I like and appreciate a lot. I think it's a really good resource. So if you are interested, I highly recommend checking it out. The important thing to know about dyslexia is that dyslexia is a specific learning disability that's neurobiological in origin and is characterized by some really specific kinds of things. Now, there's some idea about there that there's mixed definitions of dyslexia, and that's sort of true on the abstract level, but kind of at its core, there's pretty consistent agreement in terms of accurate and fluent word recognition, poor spelling and decoding abilities. And that really, it's this idea of this deficit in the phonological component of language that's unexpected relative to the other things that are happening in a person's life and brain. And so I like to think about this, right? That dyslexia is a sort of a subtype. So if you can think of reading disability as the broad category, remember I showed you for SLD, reading comes in 3 flavors, basic, fluency, and comprehension. That reading disability actually sort of falls into 3 subtypes, a language comprehension, a reading comprehension, fluency and name speeding, or phonological deficit, which we call basic reading, right? So you can see the basic reading, the fluency, and the reading comprehension reflected in these 3 circles. Dyslexia is a subtype, right? So if the reading disability is the big umbrella, then you've got these kind of 3 broad types, and you can see there's overlap there because, like I had said earlier, there's a lot of interaction and intersection. Like if I'm not a fast reader, then oftentimes my brain's ability to remember what I read by the time I plotted through a sentence kind of falls by the wayside, right? So that's going to impact comprehension, and we see that with kids all the time. Dyslexia is this really specific thing that's, not uncommon, that falls in this bubble of mostly phonological deficit, which impacts fluency, which can sometimes trickle into comprehension, but not always. And so I want to make it clear from my perspective, and I would maybe say the department's perspective too, if I could be so bold, is that it's not as if schools are not recognizing dyslexia or can't recognize dyslexia. It's this recognition that for the purposes of SLD eligibility, dyslexia sort of falls in the category of oftentimes basic reading, maybe fluency, maybe it's impacting comprehension, right? But this idea that there's no dyslexia spot or place within the rule, I think is just a misconception of how that particular type of specific learning disability gets applied. So one of the questions that I often get from parents, I got this as a practitioner, I get it from the field because people from parents call me, the field calls me, which is this idea of, do I have to see a community provider for my child to be recognized as having dyslexia, right? I have dyslexia, does that mean I have to go and spend money on a neuropsych report or go talk to my pediatrician or a clinical person somewhere? And the short answer to that is no, right? Students are entitled to have a comprehensive evaluation, which may, and I would argue, and I do with school psychs, should include phonological processing as part of the assessment if basic reading is a concern. And there's nothing in federal or state law that prohibits schools from using the term dyslexia as part of evaluation reports and IEP documents. And I would say that school psychologists should be familiar with a variety of reading assessments in general, but specifically ones that relate to phonological processing. So some things that might be assessed if we're looking at phonological processing are like young students in particular, kind of student rhyme, right? We know that rhyming is highly important basic reading skill because rhyming is really about the ability to hear sounds and manipulate sounds. Can I blend sounds together, right? So if, not even reading, right, orally. So if someone breaks a word apart for me, can I take those individual sounds and recognize that when I put them together, it makes one quick word. So if I say to someone, at, right, then you would be able to quickly process that and say, oh, that's cat. I can recognize that those small little building blocks of listening and reading combine together to make a sound. And we know that that's highly influential in the student's ability to read. There's something called rapid automatic naming, which for reasons that are beyond the scope of this webinar are also heavy indicators of reading difficulties, particularly within young children. Blending syllables, spelling is often a concern, although there's a misnomer that dyslexia is a vision problem or a visual problem. It's not. It's a phonological processing problem, but it impacts spelling because if you're having difficult time recognizing and understanding those basic building blocks of the sounds, then spelling can sometimes be a challenge. There's memory and retention assessments, et cetera, et cetera. So the point is that we can go ahead as part of a comprehensive evaluation and look at these things, and that is totally fine. You don't have to go to an outside person to do that, although you're always certainly welcome to. If you're interested in resources on that, I love understood.org. They're actually a great resource in general for parent advocacy around, specifically around learning disabilities and ADHD. They have a really great article on certain tests for dyslexia. There's no suite of tests. There's no magic like combination of things that says yes, right? But there are some things that with strategic assessment you can help to figure out. And then DPI also has a white paper. We have some guidance on SLD and dyslexia. It incorporates a Dear Colleague letter that came out of the Office of Special Education a few years ago. So if you're interested in what the department's stance is on that, I recommend that you read that. So then the second common question that I get, right, is the flip side of that. Well, what if my child does have a clinical diagnosis of dyslexia? Then what, right? So here's where I just want to again, remind us of our common definitions, right? And remember that special education eligibility is a two-pronged process. One, you have to meet the definition of a disability as outlined in IDEA and Wisconsin state statute. So the way I just talked about, right, for the last like 20 minutes, right, with the whole insufficient progress and the interventions and the progress monitoring, all of that stuff, that still applies even with a clinical diagnosis of dyslexia, because the rule is very specific that part of our obligation for comprehensive evaluation for a student is to do all those things for them. And that disability must be impacting the education to the extent that the child needs specially designed instruction. So this is the main part, and this is true for all disabilities, not just SLD. This is the main part I find where it gets confusing between the community world and the school world. And in like my life, like what I really want is for us to just like recognize how we go about doing things and be able to message those things to parents seamlessly, because I think the community providers don't fully understand schools. I think school providers don't fully understand the community. And as a result, it creates a lot of uncomfortable moments, and I think contentious moments as well. In general, right, when you go to a neuropsychologist or a psychologist that's doing an assessment or whatever else, what they're looking for is the checklist of characteristics that are usually based in the DSM-5, the Diagnostic Statistical Manual of Mental Disorders 5. Some of them use the ICD-10, it doesn't really matter, right? And that's it. They're just looking for presence, right? Presence of these things that are there. They're not necessarily looking for that impact piece, because that's not their role or their job. With schools, we're looking for both presence and impact. And it's the and impact thing that I feel like can often be a point of contention between parents and schools. And so we'll talk a little bit about, you know, what do I do? And one of the things that I often say, because I think that you can heal a lot through conversation, is talk with folks, talk with your schools, talk with your community providers about like, so I have this now, what does this mean as it relates to the review of existing evaluation data and special education eligibility? So a clinical diagnosis of any kind, doesn't matter if it's dyslexia or something else, has to be considered as part in an evaluation process. It's typically part of the review of existing evaluation data, but the IEP team gets to determine to what extent the clinical evaluation supports eligibility, right? So one of the, an appropriate pushback, I think, I don't take offense to it, is like, what does it mean to consider? To be honest with you, consider has a very broad range to it. Consider could be like, oh, we saw this and thanks very much, to we're really looking at it and taking all the recommendations. The IEP team should be making those determinations, and as a parent, you're included on that process. And so if you feel like there's parts of your clinical report that aren't being considered to the extent that they should, then I would recommend that you reach out to folks and say, hey, I'm wondering about this. Why did this person say this, but you're saying something different? The other thing that's important to know is that a person can have dyslexia and not need specialized instruction. Some students benefit from accommodations or just sort of a light touch of related services, which we would talk about in a 504 plan. Some students do perfectly fine with what we call traditional classroom differentiation, right? So the teacher is aware that maybe you need some extra time or you need things to look a little bit different, and that's just a natural part of how school does business. I think one of the things that we get tripped up in, and this is true for schools and parents and everybody else, is this idea that like special education is the only place for help, and if you're not there, then you're not receiving help. And I think that it is a place for help, and we could talk a lot about the outcomes in special education, and generally speaking, they're not super positive, but I think it can be highly beneficial for the students that need it. But if a student doesn't need it, generally speaking, right, if they're making the progress they need to make, right, if life is going okay for them, and if the folks kind of at the school can make that happen, then that's a good thing overall. And so I never want us to get caught in this, special ed is help and the absence of special ed is no help. Really what this is about is my student is not reading, my student's not writing, my student is not doing math. How do we work together to make that happen? Special education should be one support in an array of available support options. And I could talk for a long time about the places that have bigger buffets than others, I would say, in terms of support systems. So, okay, I think my child has a learning disability. What should I do, Elizabeth? Well, reach out to the school. So I would say ask about interventions that occur as a natural part of the response to intervention system. In theory, you should know about that, but communication can take very different forms in various districts. So just ask. Say, hey, my kid's struggling in reading or math. What do you notice about that? What do you do? Or is that struggle so significant from the other kids? I know with my kids, so I've got two kids, my older kid, it's hard to know, is he okay? Is what he do compared to his other peers, is it expected or unexpected? So I think asking those questions, like where do you expect my child to be and where is he at, and then how are we going to mitigate that gap, can help a lot. You can ask for an evaluation at any point. That's your right as a parent. And districts cannot delay a referral because a student needs intervention. They just can't. That's what the extension's there for, right? That's why the state gives them the benefit of saying there's no possible way we're going to get this done in our timeline because we have to do these interventions. So that's what that's there for. And if you're getting some of that from your school teams, you can remind them, well, I think you have an extension for that, right? Isn't that what the extension's for? But they cannot delay a referral because of interventions. And the Office of Civil Rights nationally is really clear about that too. And then you can ask to see student progress from any academic assessments compared to same age peers. Like I said, sometimes it's just nice to know where your child is at within the context of the broader school community. For me anyway, personally as a parent, that's always assuaged any concerns that I had to be like, oh, okay, this thing that's happening is typical because in my world, in my house, it feels different or weird or strange. I also would highly recommend that you connect to useful resources, which I know probably feels like a really odd recommendation. But as you can imagine, the internet is full of lots of thoughts and feelings about learning disabilities, some of which are very valid, although factually inaccurate, right? Like valid feelings, but factually inaccurate information. Some of it which is factually inaccurate information, but delivered in a way that doesn't validate anyone's feelings, right? I don't recommend those ones. So here are some of my favorite resources. These aren't vetted by the department. These are just when I'm thinking about learning disabilities, this is where I go. Understood.org to me is one of my favorite places for information and advocacy broadly, for parents in particular, but for educators as well. The only thing I would caution about Understood is that they're a national center, and so they sometimes don't think about state criteria. So just be aware of that, when they're talking about eligibility and whatever else, that they're really thinking about it from the big IDEA perspective and not applying the individual state lenses, because SLD looks different in every state. I love the National Center for Learning Disabilities. They have some really great resources. I love the Child Mind Institute. They do some really great stuff too and really get into kind of the neurobiology aspects of learning challenges. And then there's this really cool mentoring program for middle school students called Eye to Eye. I had the pleasure of being part of it when I was a practitioner several years ago. And basically what they do is they hook up college-age students with learning disabilities and ADHD with middle school students with learning disabilities and ADHD, and they run this advocacy and mentoring through these art projects. And so they really are teaching the kids about what it is to be a person with a learning disability or ADHD, what is it to have a good accommodation, how do you advocate for yourself, how do you help reduce stigma so that you can just be honest with folks and say, hey, this is hard for me because of the way that I approach learning. So it's a really cool program. I'm not 100% sure how to get it started in your system. I know it has to be connected to a university and then they work it out. But if you're interested and want to know more about the organization, it's there. They also do these summer retreats that are open to anybody that wants to go. And I've known a couple of students who have gone and really think it's a good, well worth venture. So with that being said, we've got about 5 minutes here for questions, so I will open up the floor.
If the student has been homeschooled, and my question to that would be homeschooled or if it's homebound instruction, but it says if the student has been homeschooled but is clearly not going to be successful, how do you discuss with the team that they need assistance, but they're not special education. And that's where I'm wondering if it's not homeschooling, but homebound instruction.
Well, homebound instruction is usually pretty specific around students with disabilities. So I think if the student doesn't have a disability, then I would suspect that it's homeschooling. But maybe, I don't know, if whoever asked the question, if you wanted to clarify. But I think that if the question is, hey, I've been providing some home-based instruction for my student or my child, and what I noticed is that they're struggling, and now I want to enroll them in a more traditional public school, and I'm worried about what that's going to look like for them. I mean, to me, my first step would be to pull a team together. I would loop in the school counselor, maybe the school psychologist, some teachers, and say, what supports are available in terms of interventions for my student, because I suspect that they're not going to be at the same grade level as their peers are. And so what can we do about that? And there's nothing that precludes people from sitting down and chatting and coming up with plans and talking about stuff outside of a SLD evaluation, right? I mean, at any point you can pull some folks from your school together and say, hey, help me, and what outside resources or what can I do at home to kind of help make that kind of a wraparound approach to that. Like I said, I really wanted to dispel this idea that there's either special ed or there's no help, because really in almost every system there's some sort of menu or spectrum of options, and that's a good place to start.
Right, exactly. And yes, and I understand where you're coming from with that question, because that is very much a concern about if they don't get special education, if they don't qualify, if they're not eligible, what's going to happen to them then?
Yeah, because at the end of the day, like, they still need to learn to read, right? And they weren't reading well, which is why they were referred in the first place. And so, like, not being eligible does not change the fact that you're still not reading well, right? So you have to find some sort of solution to help support that.
Correct. Well, thank you for going over that. I don't see any other questions. Again, it could be user error, but I've checked both places and I don't see any other questions. So with that, I think that if we're good, Elizabeth, I'm going to end the recording, and I want to thank you very, very much for doing this presentation for us today, because I think like I said, it was a lot to cover, and you did an excellent job. Thank you.
Thank you so much. Thanks for having me, and thanks for listening, everybody. Feel free to reach out with questions if you have them.
Great. Thanks, Elizabeth.